Thank you. I'm excited to be here. This is a lot of fun. Good to have the Corgi people in the front row. Yay. So I just wanted to start off with a little picture of one of my more recent litters that turned out to be a pretty nice breeding. So I've been breeding Corgis for about 25 years. That gives you a little bit of background on where I come from. What we're going to talk today about is sort of a group of different subjects that may seem unrelated, but what I was asked to talk about is kind of what's new in theriogenology. So we're going to scoot through some things that are sort of cutting edge or things that I think that a lot of breeders unfortunately don't know enough about yet, or veterinarians don't know enough about yet as well. So we'll go through those topics. So tell me what you do when your dog, this kind of dog, you wake up one morning and that's what you find on the floor. And it didn't come from your bitch. That came from your stud dog. Wow, huh? That's not good. You take him into the veterinarian. So, any other symptoms besides difficulty marking your territory? So, what do we do when we find our dog has that bloody discharge on the floor? Do we Google it? Of course. Do you call your co-owner and start crying over the phone together? Probably. Maybe you should call your veterinarian. They might have some input. So, can you do a blood test on a dog? What would you do? Would you start with a CBC to see if they're sick? Would you start with a PSA? Do PSA tests work on dogs? No. PSA tests work on people to determine if they have prostate disease, but we don't have a blood test in the dog like that. You could do a rectal exam. You could do an X-ray. You could do an ultrasound. You could ejaculate the dog for semen analysis. You could do a cytology on that ejaculate. How about a culture? Would that be good? Or how about the CPSE test? Now, that's not available in the U.S. at this point, but there is a test around outside of the U.S. that tests for prostate disease, for benign prostatic hypertrophy. So, what are the things that could be wrong with your dog if you wake up in the morning and find that discharge on the floor? There's 5 different things that frequently we can see causing blood in the discharge that comes from the penis, independent of urination, independent of ejaculation. Number 1 is going to be prostatitis or prostate abscess. 2 is going to be prostate cancer. 3 will be benign prostatic hypertrophy. We're going to talk about each of these individually. 4 will be a paraprostatic cyst. And 5 can be a urethral prolapse. Now, there can be other things. There can be dogs that have trouble with their blood clotting. They can have a bladder stone. But this is just, you walk into the house and that's what you find on your floor. So, how about a rectal exam? Any veterinarian can do this for you, right? They're pretty simple. They're pretty straightforward. It requires a glove and not a lot of other sophisticated equipment. When you're checking for the prostate is that dark structure right up under if you kind of look at that picture, you can see someone's thumb up underneath it, and the prostate is that dark structure just behind the bladder. So that gives you an idea of when the person's doing a rectal exam, the veterinarian's doing a rectal exam, what they're feeling for. So on the left picture is a normal sized prostate, and on the right is an enlarged prostate. There's multiple reasons for the prostate to enlarge, so we'll talk about those. So what about prostatitis or prostatic abscess? That's usually caused by a bacterial infection, and it's almost always secondary to benign prostatic hypertrophy, and we'll talk about BPH here in a minute. Those dogs look pretty sick. They can be as sick as a Pyometra bitch. They can have peritonitis, and they can get really sick to the point that occasionally they can become septic enough that they can die. They're not eating, they're not feeling well, they're vomiting. Some will run a fever, some will have some urinary incontinence. They may walk funny, be real stiff in the back because of pain. They may go into shock. They may have difficulty urinating. On blood work, you're going to see an elevation of the white blood cell count on most of these dogs. The differential things that you're going to be looking for are best served by doing a rectal exam and an ultrasound of the prostate. On chemistry panels, if your veterinarian does blood work, they're going to have some elevations of their alk phos. Sometimes they'll be low with their blood sugar if they're septic, and sometimes they'll be dehydrated, so you'll see some changes there. In the ejaculate, you're often going to see a cluster of white blood cells. So with a stain sample under the microscope, you can see this. That big blob of stuff in the middle of the slide are white blood cells that are all coagulated together. And then on the outside, you can see sperm that are, well, they're sperm. They're trying to breed something, so they're going to breed the white blood cells on the slide. But you'll see clumping of sperm and groups of white blood cells on the ejaculate. It'll be a pretty different looking ejaculate than what you normally see in a healthy dog. It does require treatment with antibiotics to get rid of the infection in the prostate, but they also need to have their BPH, the underlying hormonal disease, treated either with castration or with medication, and we'll talk about those different choices. Prostate cancer tends to be pretty rare. While we see a lot of dogs every year with benign prostatic hypertrophy, every week with benign prostatic hypertrophy or with prostate infections, we rarely see prostate cancer. So even though that tends to be what everybody jumps to the conclusion of is, oh my gosh, my dog has this terrible thing wrong with him, it must be cancer, we don't see it that commonly, and it is more common in neutered males, which is counterintuitive. Everybody thinks it should be the other way around, that it should be the intact male. But in reality, it's more common in a neutered male dog. Adenocarcinoma is one of the more frequent causes if they have prostate cancer. The other cause can be transitional cell carcinoma. The dogs don't initially look sick, but they do show some signs of urinary problems, including blood in the urine or blood independent of urination. Treatment is pretty grim. There aren't really good ways to treat adenocarcinomas. Transitional cell carcinomas will respond to antibiotics and peroxicam to a limited extent. Most of those dogs don't end up with a cure, but they'll end up with enough control of their disease that many of them will live a year or two with transitional cell carcinomas and appropriate treatment. It's not going to be a cure. The dogs will stay on that medication for the rest of their life. Benign prostatic hypertrophy is really common. This is the one we see the most frequently, and I get a lot of phone calls about this. Here we have the dog that, like we showed in the picture earlier, there's blood dripping from his penis independent of urination. He may strain to defecate. He may have flat ribbon-like stools. They rarely have difficulty urinating. Most of the time, it's just that they have difficulty with their stools because of the position of the prostate in the dog. It's different than it is in people. And some dogs will have discomfort or pain on mating. So when they mount the bitch, they'll have discomfort because the prostate is enlarged. And as they mount the bitch, the pressure of their weight against the bitch and then kind of squishing the prostate will cause them to have some discomfort. It's really common in all male dogs over the age of 5. It's frequently mistaken by prostatitis, and many veterinarians' first reaction will be to put that dog on antibiotics. And if they have an infection in the prostate or at risk of an infection in the prostate, that's not a bad choice. But antibiotics alone are not going to fix the problem. So then veterinarians start talking about neutering or castration. So I get lots of phone calls from people that they are concerned that that's what their veterinarian has given them for their treatment option. There are other choices, and we use hormonal treatments to control the BPH, the benign prostatic hypertrophy. It's common in male dogs over the age of 5 because as dogs age, the kind of testosterone that they make in their testicles changes, which affects the size and shape of the prostate. So it's really common, and I get frequent phone calls and frequent visits from people that they have had their dog put on antibiotics, and that's been the only treatment that's been provided. Well, it tends to wax and wane on its own. It tends to get a little bit better spontaneously and then come back to flare up again if the dog's been around a bitch in heat. So if he's traveling, if you've got a neighborhood dog in heat, if you've got bitches in heat in your household, then he may flare up again. And it looks like the antibiotics have taken care of the problem, but in reality, it's just subsided on its own, and it's going to come back and flare up again. So our treatment options consist of castration, which works really well for benign prostatic hypertrophy, but it doesn't work really well for the stud dog that people want to continue to use in their breeding program. And oftentimes we'll have dogs that come in and they have this condition and they haven't frozen semen on him yet, so they want to buy some time until they can get semen frozen or the bitch that they bought to breed him to bred until they finally decide that castration is a reasonable option for them. Treatment number 2, we no longer can get GnRH vaccine, but for a period of time we could get that, and that was a pretty cool treatment. We also have finasteride, Ovaban, Deslorelin, and Epizin. We'll talk about each of those. This is an ultrasound of a dog that had benign prostatic hypertrophy diagnosed on ultrasound. The picture prior to treatment is on the left. You can see how large his prostate is. Those two straight lines on there are the measurements that we use on the ultrasound machine, so we can measure specifically the distance across the prostate in 2 directions. And then a month later after treatment was initiated, we've got the picture on the right where we can see that the prostate on the same dog is significantly smaller in size. So castration, yep, curative, but shortens the dog's breeding career. GnRH vaccine was made by Pfizer Animal Health, which is now Zoetis. It's not currently on the market. It did cause a transient and sometimes long-term infertility, but it worked pretty well. We used it for a study the GnRH study that Pfizer funded, and it was a pretty interesting product. It was around for a short period of time. Finasteride is our most commonly used drug. Finasteride is also used in people for hair loss. So you can grow hair on people. I don't think it really improves the coat of the dog much. But finasteride is also called Proscar, and it's commonly used for treating benign prostatic hypertrophy in people and in dogs. It works quite well. It is not a cure. It does require long-term treatment. So as long as the dog is not neutered, he's going to need to stay on finasteride. But it works well to shrink the prostate and to get rid of any cystic structures in the prostate that will allow bacteria to invade the prostate and then set them up for the secondary bacterial prostatic infection. Megestrol acetate is used by some veterinarians frequently. It's a human product. Now, finasteride is a human product. We don't have that on the veterinary side, so when we use it for dogs, it's an off-label or extra-label use. Ovaban or megestrol acetate is an off-label or extra-label use in veterinary medicine. Virbac makes a product like this in Europe, but we don't see this in the United States. So we can get this as a human product at the pharmacy as a prescription item, but again, it's off-label or extra-label because it's not labeled for that use by the FDA for use in the dog. We use it, but we don't have FDA approval to use it. Then we have this terrific ad that came from Europe and it's literally says in it, spare the fruit, suspend the libido. The Europeans have the best ads for this repro stuff. I'm kind of jealous that we don't get them here. So this is a drug delivery system and a pellet that is used as a subcutaneous injection. It's a drug pellet that is a slow-release pellet, and it'll last in the dog for somewhere between 6 and 12 months. It's inserted like a microchip through the needle and does a nice job of shrinking down the prostate, but the dogs end up infertile during the time period that this drug is active. So it can be placed where it can be removed again with a minor surgical incision, but it does not lend itself to keeping the dog fertile if you're planning to use him during that time period. Ovaban does keep them fertile. Finasteride keeps them fertile. Superellin or Deslorelin does not. Now, this is one of the other great European ads. This is Epizin. There's 2 ads that I've found circulated fairly commonly of older guys hanging around with their dogs, obviously very happy. Both these guys are smiling. They're very glad that their dog has not been neutered. In Europe, they treat a lot of their reproductive disorders differently than we do. So we don't see these ads. We don't see these drugs circulating in the United States. But this is what the Epizin ads look like. Epizin is a drug that's given on a once-a-day basis for 7 consecutive days. It comes in a 7-tablet box, and it does a nice job of, again, shrinking down the prostate, managing benign prostatic hypertrophy. Again, it's not an FDA-approved drug, so this is extra-label or off-label as well. So we have a series of 3 different drugs that we offer clients as reasonable options to keep the dogs intact and fertile and control their benign prostatic hypertrophy. With both finasteride and Epizin, the warning label indicates that pregnant women should be careful handling broken tablets because of a specific kind of birth defect. So the clients do need to, as owners, you need to be aware of that. And you may be past the age of reproduction, but if you have kennel help, if you have grandkids or kids hanging around your house that are helping you with dogs, make sure that they're not handling these medications. And many of us assume that they are not pregnant, but even granddaughters get pregnant when they're not supposed to. So those of you grandmas out there, just be aware that you need to be careful with having these drugs handled inappropriately if it's a young female that could be pregnant. So who's this Virbac company that makes this product, the Epizin, and makes this product, the Superellin, and makes this product, the Ovaban? Anybody recognize this name brand? Virbac? Yeah. You do, right? We don't have any of these drugs in the U.S., but this is a pretty major drug company in the United States. Name a drug that they make. Anybody can do that? They make the shampoos, right. They make the shampoos that are shown here in the bottom, the Pyometra and that whole line of shampoos. They make the CET dental products. Veerback makes those, the toothpaste, the chew strips, all those products, and they make Iverhart Max. So these are commonly used pharmaceutical agents and products in the United States made by this company, but it's not one that we really associate with the kind of drugs that they show us in Europe because they're just not approved for use in the U.S. The use here is so limited that the company doesn't have the financial motivation to have that drug approved or those drugs approved in the U.S. So, yep, we know those drugs and that drug company, right? So it's out there. You just have to figure out the best way to manage that. So those are the Veerback products. All right, paraprostatic cysts are not common, but we see them every now and then. We diagnosed one this week at our hospital. We see maybe one of these a year. On ultrasound, this will look like another bladder in the dog's abdomen. So it'll look like the dog has 2 bladders instead of 1. It's a very large cystic structure that's off the side of the prostate, and they happen infrequently but can be pretty dramatic. They can abscess and the dogs can get pretty sick, or they can have difficulty with urination. But they do have some signs of abnormality with their fertility, or they may have bloody discharge from their penis independent of urination. Treatment consists of surgically taking care of this by letting it drain into the omentum, which is a complicated surgery for most general veterinarians, and it's usually going to be done by a surgeon or someone that does repro. Urethral prolapse is relatively common in really young dogs. This is not something you're going to see in the over 5-year-old dog. We see it frequently in bulldogs and some of the other young dogs. That is just the tip of the urethra will extrude through the penis and cause some bleeding. We had one bulldog that had a pretty dramatic amount of blood. These dogs are too young for prostate disease, but it can be fairly dramatic. So it's one of the things that should be looked at if your dog has any bloody discharge from the penis that can't be explained easily. It just takes a simple physical exam and manipulating the penis to take a good look to see what the tip of it looks like. So that's what causes bloody discharge, and many of those are very treatable, and we can keep our dogs intact. So this is who I am. I run this veterinary clinic in Lomira, Wisconsin, which is about halfway between Green Bay and Milwaukee. I have these fabulous people that work for me. This is my husband and his favorite Facebook picture of him in our barn a number of years ago when our kids were in 4-H. I have these great doctors that work for me. These are my kids. The book. There's a green flyer outside the room. This book has been a long time in the making, and it's to be released on Monday. So we just missed the weekend for this, but this is a practical guide for veterinarians, veterinary technicians, and breeders. It is written to be really hands-on, practical. What do I do at 2 o'clock in the morning when something's going wrong with my litter, with my bitch, with my male? So it's really just, like I said, very, very practical, very hands-on. It's written for everybody in the room. So if you're interested, it's going to be available. It's already available on Amazon for pre-order, and the flyer has information on it, as well as some other really great books that go well with breeders. Information. So this is Dr. Zella. These are the people who made it possible for me to be here today because they're home doing the stuff that I usually do when I'm there. Dr. Moore, Dr. Kowaleski, and Dr. Dowling. So those are my docs, and thanks to them for running the place. They're fabulous people. So we're going to talk about additional things here. We're going to talk about some fresh and frozen semen information, Pyometra and the bitch, and then our spay-neuter controversy. And as I understand it, Dr. David Waters spoke a little bit ago, and we'll be speaking again today about lifetime ovary exposure and how that relates to longevity in the dog. That's the Rottweiler study, the Old Gray Muzzle Tour. So, frozen semen breedings. This is what we want. We want a maximally sized litter. This is a Bernese Mountain Dog bitch. We're waking up from her C-section. It's a little hard to see in the picture how many puppies are there, but she had 13. This was a breeding that we did a number of years ago, and the client had been told by all of his friends in Bernese Mountain Dogs that Bernese Mountain Dogs don't get pregnant with frozen semen. I don't know. Did you want more than 13? That seemed like plenty to me. So Done well, frozen semen breedings can be very successful. So we're going to talk about a number of different topics today: timing the bitch, vaginal AIs, shipping semen, frozen semen, TCIs, surgical inseminations. So for about 35 years, people have been freezing semen, veterinarians have been freezing semen, and non-veterinarians, to use later on in a different location or in a different time period. We're using semen right now that's sometimes as old as 30 years old and still successfully getting litters of puppies from it. It's pretty exciting to bring that longevity or that depth of pedigree back into reality. But for most of the time, the success has been limited by our ability to do progesterones. We have to have exact timing because the semen with frozen semen lives a short time in the bitch's reproductive tract. So the more accurate the progesterone testing has become, the more successful we've been in being able to produce great litters. In 95, we did our first frozen semen breeding. This is Bingo. She was an 8-year-old bitch. We got progesterone level results back. It took a week. A week is a pretty long time to go. It now takes us 45 minutes. And the staff goes a little nuts when they're standing at the machine staring at it, wondering what takes so long. Like, we kind of threw a dart at the calendar on this breeding and said, well, I think this is probably the right day. She had 2 puppies. I think this is the right day to breed. But for an 8-year-old bitch with frozen semen having absolutely no information on progesterones, we were pretty excited that we got this. So now we know with better timing that we can have some pretty amazing litters. That's another litter of corgis. That's a little litter of 10 that I had. So what is the who, what, when, where, why, and how of using fresh chilled or frozen semen? So we'll start with who the people are. So who are the people? And that would be any breeder interested in expanding their genetic opportunities outside their chronological or geographical area without traveling a long distance in time or space. It's pretty hard to go back in time. So like I said, when we're using semen that's 25 or 30 years old, it's pretty cool to be able to do that. It keeps you from having to ship bitches or take yourself halfway around the world if you want to use genetics. I proudly own a Danish-Swedish farm dog as well, and when I get ready to breed her, there aren't a lot of Danish-Swedish farm dog stud dogs in the U.S. So I'll have opportunities to breed her to stud dogs I wouldn't have if I didn't use fresh chilled or frozen semen. So it's any breeder willing to go to the additional time, trouble, and expense, and we recommend that you use a veterinarian who's had some experience in this modality. It takes a little bit of attention to detail and some practice. So I'm not saying that you shouldn't start off with a veterinarian that doesn't have some experience, because everybody has to start somewhere, but you want to try to make sure that you have the best outcome by using someone that's got some experience with this. So who are the dogs that we want to use? Well, we want it to be a healthy, sexually mature dog. We want him to have passed his appropriate genetic screening, who's got the great temperament, the superior specimen of the breed, and shows promise of great longevity. Isn't that what everybody wants in their stud dog? That's the perfect package, right? So everybody wants a smart dog or a highly competitive dog. These are some pretty high-powered dogs that are big winners. And of course, we have our big winners in the conformation rings as well, agility, all those different events. And sometimes it's just because there's nothing wrong with having a really great pet dog. This is an adorable little puppy I sold to some people in Chicago, and I'm pretty sure when that little girl wakes up, she's going to have a grid pattern on her cheek that matches the tile on the floor. So we're going to define a little bit of terminology, the what of this. And that's fresh semen is semen that's collected at the time it's to be used and inserted immediately. And that's when both the stud dog and the bitch are on the same premises. Fresh chilled or extended semen is collected usually around 24 hours prior to insemination, depending on if it's a weekend or a holiday, because that's when your breedings are always going to happen, right? Over Christmas, when Christmas falls on a Monday and you can't get a shipment anytime between Thursday and Tuesday. So you collect the semen 24 hours prior to insemination. It's transported from the location of the male to the location of the bitch. That's usually courtesy of FedEx, UPS, the Postal Service, one of those delivery systems, but sometimes clients will do the drive instead. And then we have frozen semen. Now that can be collected at any time in advance of its use. It's frozen in liquid nitrogen and stored until it's ready to use, thawed, and immediately inseminated. So then we have to use specialized insemination techniques, which we'll talk about. The stud dog does not have to be available. He can be deceased. He can be in another country. He can be neutered. Once the semen is collected, then his business here is done. So then we'll define some other terms. Artificial insemination. People throw around AI quite a bit. We have fresh AIs, which are both the dog and bitch on premises. We have fresh chilled. Like I said, that avoids the travel and the shipping. We have frozen when the stud dog is unavailable. And that's done either with surgical or TCIs, but not vaginal inseminations. We have surgical inseminations, and then we have TCIs, and we'll talk about each of these. I made up this little chart because I think it's a little bit confusing to figure out how you use all the semen all the different ways. So natural breedings, obviously, are fresh semen. Vaginal AIs are done with either fresh or fresh chilled semen. We can use transcervical inseminations for fresh chilled, or for frozen semen. We can do a surgical breeding for any of those three kinds of semen. Multiple sire breedings I'll just talk about very briefly, and that can be done any of those three ways, and that's when more than one sire is used, and then the dogs are DNA tested, the puppies are DNA tested along with any potential fathers and the mother to determine who the sire of, or sires of the litter are. And then you can do combinations. We'll have some people that will want to put in 2 different dogs. We'll have some people that want to put in some fresh and some frozen. You know, it's really a lot of different variation just depending on what the breeder desires and what they really have for goals. So there's a lot of discussion that goes on with this decision making. So this is what a natural breeding looks like. This is a tie. I didn't get the AI done in time in my office. So I had to get out the camera and take a picture of what a natural breeding looks like because we so seldom see those. You guys do those all without our help. This is a Wisconsin tie. These 2 dogs were in a tie long enough that the client started to feel sorry for them and took the Barbie blanket out and draped it over the dogs so that they didn't freeze during the time that they were in their tie. When we use fresh chilled semen, the semen comes in a styrofoam shipper, sometimes in a stainless steel thermos, depending on how brutally cold the weather is. We'll throw in a stainless steel thermos when we have temperatures below 0 in Wisconsin and it's coming from the north. Semen coming from Canada is not coming from a good place when it's so cold that it freezes in the back of the UPS truck. Frozen semen that way doesn't work out too well. So we have the fresh chilled box that comes. We have our lovely little Finnish Lapwing bitch here waiting for her boyfriend to arrive. He's shown up in the box. And then we have frozen semen. There are either pellets or straws that we can use for that. So when do we breed? We inseminate during a normal estrus cycle. We like the cycles to be as normal as possible. So if you have something odd going on with the heat cycle, we're probably going to discourage you from using any kind of sophisticated breeding like frozen semen. We want to have a nice normal cycle. We want it to be a young and healthy middle-aged bitch who has passed all of her health screenings and has all the same criteria as our male with good temperament, promise of good longevity. We like to use a young, healthy adult male, but any age male that has viable sperm is still eligible. After the age of 12, AKC requires paperwork to support the fact that the dog is still viable if we're collecting semen at that point, but that's no big deal. We can easily do that. So when do we collect semen on the males? We like to freeze early and freeze often. Obviously, this puppy is too young, but as soon as they start producing sperm, I'm okay with starting to freeze it. So when, for the timing on the bitch, we need to have very careful timing done anytime we're using shipped or frozen semen because the semen isn't going to live as long in the reproductive tract as it will if it's fresh. And it's also helpful for any stud dog or any bitch with a history of fertility problems. So if you have a male with substandard semen or you have a bitch that's missed, you want to have really great timing because that's going to improve the chances that you have a fertile breeding. And everybody's goal isn't to spend a lot of money and end up with nothing at the end. Everybody's goal is to end up with a wildly successful litter. So timing is critical not only so we know when to breed, but because we also know then when she's due to whelp. If we know the day that the bitch ovulates, we can predict within a 24-hour window, plus or minus, the day that she should be due to whelp. So that makes everybody's life a lot easier if we have a bitch that has a small litter or if a bitch that is likely to need a C-section because of her breed or other circumstances. So it's really great to have your timing up front so that we can then know what day she's due to whelp. Our goal, of course, is to have a successful pregnancy and a successful outcome to that pregnancy. At our office, we use this spreadsheet. My clients affectionately call it the rainbow sheet. We put in the date that the bitch was bred, and from that, the computer automatically calculates when she's due. So it goes through and tells us when we should take out sutures if she was a surgical breeding, when we should do the ultrasound, what day we should start our Panicure therapy. And I don't have a slide on that, but I am going to briefly mention that we do use Panicure or recommend Panicure for almost all of our pregnant bitches, starting on day 40 of their pregnancy and continuing through day 14 of their lactation. That significantly reduces the transplacental and transmammary transmission of parasites, roundworms and hookworms. So we have healthy, happy little fat puppies that don't end up with that 3-week-old kind of not feeling very well during the parasite migration into the gut stage. It then goes on to tell us if we should put on our DAP collar if we're planning a C-section. We use those on our bitches, what day to do the C-section and what day she's due to whelp. So this is a pretty handy little piece of paperwork that we hand to our clients. They put it on the refrigerator, and then they've got their schedule all set out for the rest of the pregnancy on the bitch. So why is timing critical? Can I just sort of let them figure it out? And can I just breed on day 12 and 14? I mean, that always worked before, right? Well, we're spending a lot of money. We may have limited availability of semen. We may have a risk to the bitch if she's carrying a pregnancy that she's only going to have 1 or 2 puppies because we didn't time our breedings as well as we should. There's a cost to missing a breeding. There's a cost to you of how much you spend on the semen and on the stud fee. There's a cost to you for missing a litter because you don't have puppies to sell to those people who have been waiting. And there's a cost to you of having your bitch start to age at a time that you really need a litter of puppies out of her because she's getting up into an age group that she's no longer likely to be fertile. So those are all costs. Maybe not financial costs, but they're still costs. And we have to worry about our aging stud dog as well, as we have those boys who are getting a little bit older, and we worry that our young bitches may not be around when the stud dog is, or that our stud dog may not be around when our bitch is. So we want to make sure that we're really pretty effective in getting our timing done correctly. It affects litter size. If we're too early or too late, our litter sizes are going to be smaller. And that's important in our successes. So how do we time for breeding? Well, we have the stud dog. He'll tell us when he's interested, right? Well, sometimes he's pretty accurate and sometimes not. Sometimes they're timid or they're afraid of the bitch. There's a lot of reasons that the male dog may not be accurate on his timing. We have the bitch's receptivity, so she should tell us, right? Well, not always, because some of them are really bitches. We have vaginal cytologies. We have vaginoscopy, where we look into the vagina and see what the tissues look like. We have progesterone testing, and we have LH testing. Now, some dogs are pretty suave, and they will bring her roses. And then we have the other dogs who are kind of klutzes, and they would bring dandelions. We all know those. This is a picture of the dandelion dog. He was simply not able to finesse the bitch into believing that a breeding was a good idea. She was standing like a rock. He was not so good. So we ended up with an AI on this breeding. But sometimes you just know that it's not going to work out. You have a clueless male, you have an even more clueless female, and sometimes you just have to intervene. So our vaginal cytologies can be helpful. And in the old days, this is what we had to go on because we didn't have progesterone tests. The slide on the left-hand side is a slide of a bitch in proestrus. She's got cornified cells but has white blood cells in the background. And then the slide on the on the right is the bitch on her way out of heat. So the cells are still cornified, but now we have white blood cells in the background. That's not a good enough determination for me to know what day to put in frozen semen. And I have clients that spend $2,000, $3,000, $4,000, $5,000 on semen. I'm not going to throw $5,000 worth of frozen semen in a bitch based on a vaginal cytology. I need to have a lot more accuracy when I'm doing those kinds of breedings. And we use progesterone levels because my staff, in spite of how great they are, do not have a crystal ball. They cannot tell you what day she is ovulated unless we do something pretty specific like progesterone testing. It's an easy test to interpret. It's readily available. Almost every hospital can get results back now within 24 hours, and some in less time than that, depending on where you live. And it's a reproducible test. From one lab to the next, the results are pretty consistent. So progesterone has really become the test that we use the most frequently. There are different kinds of progesterone tests. There's a quantitative test, which can be run on a piece of equipment, either at a reference lab, like IDEX, Antec, Marshfield, or one of these two pieces of equipment, and there's also an immunolite. The one on the left is the TOSO machine, the one on the right is a mini Vitus, and a lot of veterinary clinics that do a fair amount of reproduction will have pieces of equipment like this in their hospital to get us results back quickly. The wells on the bottom, those little pink wells, that's a semi-quantitative test. It'll give you an idea of when she ovulates, but there's no numbers associated with that. The numbers written across the top are the dates written by the client who was using this, but they're not actual results. So when I'm doing a progesterone test, I want to know I have a result back of 4.6 or 7.2. I don't want to have bluer than yesterday or pinker than before. That's not accurate enough. When you're successful and you have these nice big litters, that's when clients realize how important timing really is. There were 14 in that litter. So a progesterone test is the most accurate way that we can time breedings. We don't like to do the semi-quantitatives if we can get our hands on the quantitatives. LH tests are also helpful, but there's been some problems over the years with using those. This is Marshfield's flyer from a couple of years ago, Timing is Everything, Progesterone Testing. And this is how they tell us to interpret the results. In dogs, follicular luteinization occurs prior to ovulation, but it can be used to estimate ovulation timing. 2 days prior to ovulation, serum progesterone levels increase from non-detectable to values up to 2. Serum progesterone progressively increases to peak at 4 to 10 at the time of ovulation. Since ovulation takes 2 to 3 days to complete, the optimum breeding time is 4 to 6 days after progesterone reaches 2. What does that mean? I mean, that's what the test results tell you at the bottom of it. What does that mean? Well, I don't know. I just go back to this. So we know that bitches have a progesterone rise prior to their ovulation. It coincides with the LH peak. As soon as the LH peak occurs, which is that very short window of time in there that has LH above it, that's when we see the progesterone levels start to rise. And as the progesterone rises, then the bitch ovulates, enters her period that her eggs mature, and then enters her fertile period. So what do I do with progesterone levels? I'll tell you that this is what we do is the magic numbers are 5 and 20, and there's a typo on this slide. So 5 tells us when she ovulates, and then we breed with frozen semen anytime she's over 20. We like to breed somewhere between 12 and 20 with fresh semen and over 20 with frozen. We breed 48 hours after ovulation with fresh semen, and this is where the typo is it should say 72 hours after ovulation if it's over 20 with frozen semen. So 2 days later after ovulation of 5 at our lab with fresh, and 3 days later with frozen semen. That's consistently what we do. Different veterinary clinics are going to have some slightly different twists on this, but that's generally the way that it's going to be interpreted. All right, this is what an LH test looks like. For a long period of time, we couldn't get the test kits at all, so that's when we stopped typically using them. There are advantages to them. They tell us exactly what day the bitch ovulates. The disadvantage is that every 24 hours, we need to do a blood test on this bitch to determine what day she ovulated. And I don't have a lot of clients or a lot of bitches that like to come in every 24 hours at the same time of the day to have this blood work done. So we tend to use more of the progesterone levels. So why do we do some of these in extended semen breedings? Well, we may have a non-receptive bitch. We may have a disinterested male. We may have incompatibility in size. We may have a male or female that's physically unable for a variety of reasons. So and we also may do them because we have semen that needs to go somewhere else. This is semen that we shipped over to Sweden and produced a really nice litter of puppies over there. So does it work? Yeah, it does. It has for a long time. We have nice litters to show that it really does work. And on my website, I have some information on how to use fresh chilled and frozen semen. It's very easy to get semen into the U.S. It may be difficult to get semen out. If we're doing fresh chilled semen, you want to plan ahead. You want to have a shipping kit well in advance of the time that the breeding needs to be done. We need to time our bitch, plan our shipment, plan for overnight shipping. Airline counter-to-counter shipment is really a very difficult thing to do any longer. And then at the very last minute, this is where you go into panic mode because you know it's going to be a weekend, a holiday, or something has gone wrong. You can't collect the stud dog or the shipment gets lost. Something can terribly go wrong. And so then you have to have a change of plans, and then you get around to insemination. Does it always go wrong? No, but it happens often enough that you need to have a plan B in mind. These are our mail order brides. This is how we use our frozen semen shipments. We like to have our tubes labeled. The slide on the right shows the dog's name and the breed written on the tube. Please make sure if you're shipping semen out of your veterinary clinic or if you're doing it yourself that you put the dog's name on the tube. This week we had 2 shipments that came in the same day on 2 different dogs, and one was labeled and one was not. So, that's when you realize that it's really important that you label every tube, because we don't want to create mixed breed litters by mistake because we have unlabeled semen arriving at our veterinary clinic. It goes into a styrofoam box. It does not go into the styrofoam box looking like this. This is a tube rubber banded to the frozen ice pack. That's not going to work. So please don't do that. That's actually a shipment that we got into our office. It needs to have a little bit of a barrier of newspaper between the semen and the chilled pack and then the ice pack. So instructions are pretty clear that come with the kits. Just follow the instructions so that you do it correctly, and remember to label the tube. The finished package looks like this, and then we go ahead and ship with, usually FedEx. But like I said, sometimes things get lost along the way. Sometimes it just doesn't work out the way it's supposed to. So we count on FedEx or UPS frequently. And if you learn nothing else from today's presentation, I want you to realize that there's an arrow in the FedEx label. Has anybody ever seen that before? Yeah. Once you see it, you'll never look at a FedEx truck again without looking for the arrow. That's how you know that that's not really the FedEx logo, because there's no arrow in there. So there you go. So from here on, you will see the movement in the FedEx logo. So UPS, FedEx, U.S. Postal Service frequently work well. Do you have to use a veterinarian? AKC has recently changed that so that you no longer need to for fresh chilled semen. But we still like to, because we like to have a semen evaluation along with a sperm count, and we like to know viability of the semen, motility, and morphology. So it takes a lot of attention to detail and great communication on the parts of all the people involved to make sure that the right semen gets to the right place at the right time. In frozen semen, it also takes a lot of coordination, but it may take up to a year to get semen overseas to certain countries, especially the island countries. It can take sometimes as little time as a week, but it can take up to a year for Australia and some of those other countries. So you want to plan well in advance. Again, we want to use our healthy bitch, and we'll talk about our different techniques. Frozen semen that we use is frozen in pellets. We freeze this way, so it comes out in pellets, looking like this, a lot like Dippin' Dots ice cream. I've made Dippin' Dots. It's kind of fun. We also see semen frozen in straws. There's a lot of discussion among veterinarians which is better, and which is better is whatever works for you. There's good success with both techniques. Semen tanks that we store in do not have electricity. They're stored in liquid nitrogen. And we ship in dry shippers, which are about as high as your knee. So there's some size and cost that goes with that. We want to make sure our dogs are genetically screened, and that he's somewhere between 2 and 5 is our ideal age. We want to make sure that he's still producing good, viable semen, but that he's old enough to have good semen as well. Freeze early and freeze often. Try not to bring dogs to us that look like this. This is an actual case that came to us. The dog was sick with cancer, and they were hoping that they'd be able to collect semen. This is not the time to start backpedaling and realizing that you've missed that opportunity time to freeze your dog's semen. So as soon as you have an eligible-looking dog, he doesn't have to have his championship. He doesn't have to be finished. But you know who your young up-and-coming dogs are. So those are the times to start freezing semen. When you use frozen semen, we want to use our resource wisely. There's a limited quantity of it in almost every case. It needs to be done with perfect timing so we have good outcomes. Here's my lawyer hat. Please have a contract with the people that you're working with, especially if it's a friend. That's when those relationships really fall apart, is when you think you thought one thing and they thought another, and if the bitch didn't get pregnant, do you get another breeding or not? And this is how friendships fall apart. So put it in writing so that you have very clear definitions of what you're expecting with a frozen semen, even with a fresh chilled breeding arrangement with somebody. It will save you a friendship someday down the road. So please make sure you put this in writing. Transcervical inseminations are more frequently being done now. Some veterinarians are doing them exclusively. We're still doing a few frozen semen breedings if we've got a bitch that has a particular reason to be bred that way. This is what TCI looks like. That's one of my corgi bitches on the table. We use a long 27 centimeter scope with a camera attached to it, and then next to it is the TV screen. So we're able to visualize the cervix, and with the endoscope, slip a catheter up into the cervix, into the uterus, and deliver semen into the uterus directly. If you're looking at it anatomically, the scope goes upward and then forward into the vaginal lumen, and then we find the cervix. On a picture that comes from a camera, you're going to see the cervix, which is that pinkish, kind of bumpy looking area, and then the green tube in the center is what the catheter looks like as it's delivering semen into the uterus. It's very cool. The drawback to transcervical inseminations is we can't get our hands on the uterus, so we can't tell if she has cysts or other pathology in the uterus. You can easily visualize where the semen should go with most bitches, but we can't do anything about any uterine pathology because we can't see it. I'm not sure if this video is going to play. I don't think so. So I'll put this video up on our Facebook page. It's a video of us doing a TCI. But essentially, we put the bitch on a hydraulic table. We raise the table. She comes up to shoulder level. And with her standing, with no sedation, without any anesthesia, we have usually one or two people, usually the stud dog or the bitch owner near her head so that she feels comfortable that she's there with someone that's with her. And then we have another staff member helping hold her and a staff member managing the semen. And we'll be able to inseminate the bitch. Usually within about 2 minutes of the time that we get her onto the table, we can find the cervix and successfully cannulate it. Then over the course of the next 10 minutes or so, we'll inseminate whether we're using fresh chilled, or frozen semen. So it's just set up that easily. It's really a pretty straightforward procedure. The difficulty in these is that it takes a long time to learn how to do them. There's a learning curve that goes with it from a veterinarian's perspective, and it's pretty expensive equipment. So it has to be used in a practice where there's enough use of it to justify the cost of the equipment. It's running around $15,000 or so to set up for a TCI to do that. So who's a candidate for surgical inseminations? Let's talk about surgery. The advantages, disadvantages, and costs. With surgical breedings, that's a full anesthetic procedure with a surgical breeding. We exteriorize the uterus and directly put the semen into the uterus using a catheter. Now, this does not impact future breedings. The bitch can still be bred and the bitch can still have a C-section, so it's still very successful. Some of the advantages to it are that it is your greatest chance of having a litter of puppies, and it doesn't require $15,000 of equipment. Any veterinary clinic that can successfully do a spay will be able to successfully do a surgical breeding. It's pretty cool. We can put our hands on the uterus. We know exactly what's going on, and it's a pretty short and easy procedure. She's in and out the door in about 2 hours. If we're going to do one of these, we'll start off with a semen collection. And this is one of the series of pictures that a client took for me. She took a picture of the clock and then timed everything for us right out from there. We collected and processed the semen, took a look at it, made sure it was viable, did a sperm count, extended the semen, got ready to anesthetize the bitch, put in an IV catheter, anesthetized, prepped her, moved her into surgery, shaved her, had her under anesthesia, hooked up to a monitor. That's my husband monitoring her. There we are getting ready for surgery. There she is on the table. Beautiful view of the dog, right? Made a small incision, exteriorized her uterus. So that's the uterus at the uterine body. So for those of you who haven't had the chance to see one of these up close and personal, that's what they look like. We have the semen in a syringe. We put the catheter into the uterus, inject the semen into the uterus slowly so that the uterus has time to expand. Sew her closed, staple her up, and I did not turn her from a Gordon Setter into a Nova Scotia duck-tooling retriever. I just didn't take a picture of her as we recovered her. So we recover them hind end up in the air, and we're done. So it's a pretty short procedure. It is invasive, more invasive than a TCI, but like I said, it doesn't require some of the equipment, and it has some of the advantages of being able to check more carefully what's going on inside the uterus before we do anything. Especially if we're going to thaw out frozen semen, we want to be sure that the semen quality and the uterine quality is good enough. And this is what we produced. And yes, Gordon Setters do come in different colors. And there they are. These are serosal cysts. We'll often see these on the outside of the uterus if a bitch has had a C-section in the past. That does not impair fertility. So just because you see those doesn't mean the bitch can't get pregnant. Those bitches can still be bred. Those are not the kind of cysts that we're talking about when we talk about popping cysts. These are the kind of cysts we're talking about, and these are actually in the lining of the uterus. They look like bubble wrap. They're just little cysts, one on top of the next, on top of the next. These are bitches that don't get pregnant. If there's a few cysts, there's some really hot arguments that go on the Theria list. If you want to start a fist fight cyber fist fight. You can start off by saying, I think popping cysts, I think not popping cysts fixes the problem. Well, there's a lot of discussion about it. Nobody has a really good controlled study on it, but we know that this is what cysts inside the uterus look like that impair fertility. There's no place for placentas to attach. That's just not a uterus that's going to be fertile. So this was a bitch that was meant to be bred surgically, but at the time of the surgical breeding, it was determined that her disease, her cystic endometrial hyperplasia, was so severe that we spayed her instead. She was on the fast track for other issues with her health. So how long does frozen semen last when it's stored? We don't know, but we're using bull semen that's at least 40 years old. We know dog semen is still at 30 years old, doing well. When we wake it up, it swims just like it did when it was first frozen. In a regular AI vaginally, we just put the semen in vaginally. When we're doing frozen semen, we want to put it into the uterus because we have huge differences in conception rates. If vaginal inseminations are done, we get about 11% of the bitches pregnant with frozen semen, but we get around 83% if it's put into the uterus directly. So let's talk a little bit about our bitch. We're going to talk about treating pyometras medically, interrupting pregnancies, and SIPs. So pyometras, everybody knows what a pyo is, right? Pyometra strikes fear into the heart of all bitch owners. It's become a verb in most people's vocabulary. My bitch is pyoing. I think my bitch pyoed last month. So we have that now as a verb, not just a noun. It's rare in the young bitch, but I have seen it as early as the first heat cycle. And it's most of the time seen in bitches that are somewhere over the age of 8 or 9. Only humans and gorillas go through menopause. Dogs do not. So remember that she will continue to have heat cycles throughout her life. When a bitch's reproductive life is over, it's still recommended that we spay her, and we'll talk a little bit about that in a few minutes. But overall, the statistics show that about 25% of bitches over the age of 9 get pyometra. Now, in 2012, a really interesting study was presented at the International Symposium for Canine and Feline Reproduction. It was a study done out of Sweden that listed about 120 breeds of dogs and their incidence of pyometra, their incidence of mammary tumor, and their incidence of both. So on this slide, you can see that Bernese Mountain Dogs lead the way at 62%. 62% of Berners, if they're not spayed, end up with pyometra. Close behind them are Great Danes, Leonbergers, Rottweilers, Irish Wolfhounds. So those are our top 5. Those are all giant breed dogs, all from European descent. I think there's got to be something going on here that's genetic. I think there's little question that there's some tendency that the precursor to this giant breed group of dogs that we see out of Europe were probably affected by something that causes pyometra. We don't understand it really well, but that's a pretty high percentage. So if I had a bitch in one of those breeds, I would start talking about spaying her as soon as I'm done with her reproductive life. Then we still see Staffordshire Bull Terriers, Case Hounds, Bull Terriers, Bouviers. So the list is on and on. You can find this article if you Google search it. It's a pretty interesting article to take a look at if you have the desire to know what your breed incidence happens to be in both mammary tumors and pyometras. This is what a pyometra looks like surgically. It's a pretty nasty, big uterus full of pus. We need to get rid of those. We can do them surgically, but there is also medical management. And we've been successful in treating bitches medically for pyometras for close to 15 years. My daughter had a Bernese Mountain Dog bitch many years ago that had a pyometra. We were successful in treating her bitch. So it's been working for a long time. This is what happens when you don't spay a pyometra. You get puppies. This is a bulldog litter. She had a litter of puppies in one horn and a pyometra in the opposite horn at the same time. This is a Amstaff bitch that we did not end up spaying, but she ended up producing 8 puppies after we did medical management and a TECT, which we'll talk about here in a minute. These are her puppies. Pretty soon they were bigger than she was. And this is my daughter's litter of Bernese Mountain Dog puppies out of her bitch that we did not spay. She had a pyometra when she was 2.5, bred her at 3, didn't get a pregnancy, and at 3.5, this is what we got. She ended up having another pregnancy at 7. So it can work and it can be very successful. This is her litter as well. If you set the right expectations for clients, they can understand that there are certainly good outcomes from medically management pyometras. Do they all work all the time? Absolutely not. But there are no guarantees in fertility and nothing works all the time. So our medical management of pyometras, this is a summary of it. Of course, they need an antibiotic because there's a bacterial infection, but the antibiotics don't penetrate into the uterus particularly well. So along with that, and by the way, bitches with pyometras do not typically run fevers. So if you're waiting for her to have a fever, if you think she's got a pyometra, you're going to wait way too long to see veterinary care. So please don't assume that a fever is going to be happening with this. I don't understand why there can be that much pus in the uterus and the bitch doesn't end up acting like she's got a fever, but they don't run fevers. I think there's some discussion that needs to happen on that. Along with antibiotics, we use prostaglandins. Now, there's a couple of different kinds. We typically use Lutalice, and we typically give 5 injections a day. In Europe, they have a drug called Alazine, or a hormone called Alazine, that's also helpful in treating these, but again, that's an extra label or off-label use of drug in the United States. So we typically will use prostaglandins. We'll walk the bitch every time she has an injection. So in January, my staff that smokes fight to get a chance to take care of the pyometra bitch because they get paid to go outside and smoke a cigarette and walk a dog. Nobody else wants to walk them in January, so it works out pretty well. So we give 5 injections of low-dose prostaglandins a day. Along with that, they need fluids. If they're vomiting, we'll put them on Reglan. If their progesterone level is still high, we'll put them on bromocriptine or cabergoline to help drop the progesterone level. If the cervix is not opening up readily, we'll use some misoprostol at the opening to the cervix. And one of the new procedures that we've been doing that is still unpublished, but there's some information circulating out there, is called the TECT procedure. Now, if you end up at an emergency clinic and it's 2 o'clock in the morning with your pyometra bitch and they want to hover over her with a scalpel blade, if you can get them to start her on IV fluids, well, you know how they are. If there's an excuse to spay, they're going to find it. So if you can get her started on fluids and some antibiotics and get her, through the night, a couple of hours, and get her to your repro veterinarian in the morning and get her started on prostaglandins, you can still save her uterus if she's not too sick. Now, the question is, what's too sick to treat medically? What's too sick to treat surgically? There are definitely bitches that are better off treated medically when they're really sick because they just simply may not be a candidate for surgery. Dr. Hutchinson has one of my favorite quotes, and that's, I've seen a lot of bitches too sick to go to surgery with pyometras, but I've never seen one too sick for an injection. So there are absolutely bitches that will respond very well. We had a collie bitch a number of years ago that was so sick, there was no possible way she was going to make it through surgery. We treated her medically. She didn't lift her head for 36 hours with her owner sitting next to her on the floor. She didn't move. And on hour 37, she decided she was going to live. So you can treat some of these bitches medically and be very successful. The TECT procedure, like I said, is an unpublished bit of information. It's been circulating a little bit around the Therio group. And essentially what it is the use of the endoscope to place a catheter up into the uterus and flush the uterus or lavage the uterus out. This is a golden retriever bitch standing on the table. At our office, there's some discharge. It's a little hard to see with the color of the slide, but there's some discharge. And essentially what we do is the same thing as when we do a TCI, in that we introduce the scope into her vagina, we pass a catheter through that up into the uterus, and then we irrigate the uterus with lactated ringers to help flush out the uterus. That, combined with the other parts of the protocol, these drugs, we've been pretty successful in treating these dogs. Do they all get pregnant? No, but we've had pretty good success. That bitch, the Amstaff bitch that had 8 puppies that I showed you a picture of, she had Lutalice, antibiotics, and the TECT procedure done and was very successful in carrying her pregnancy. I've got a bitch coming in this coming week that we bred 3 weeks ago, and she'll be ultrasounded to see if she's pregnant, and we had treated her also with the TECT procedure. So it's a pretty interesting procedure. If it's a veterinarian that you're working with that has an endoscope, you may want to talk to them about whether this is a treatment option for them. This is what the uterine bifurcation looks like through the endoscope, so you can see both uterine horns with the scope. Okay, so what happens if your bitch gets bred by the wrong dog? Do you have to spay her? No, you could spay her. The first thing we want to do is ultrasound her and see if she's actually pregnant. If you've done a cytology and you found sperm, odds are she's pregnant. But 62% of bred bitches are not pregnant, even when there's a witness breeding. So you can either let the bitch whelp and then DNA the puppies to determine who the sire is. You can spay her, or you can interrupt the pregnancy pharmacologically. Typically, what we've been using for the last 5 or 6 years is cloprostenol. It's a series of 2 injections, 4 to 5 days apart, along with some bromocriptine or cabergoline to drop the progesterone level. And we've had, with the exception of one bitch, 100% success. We had one bitch that was a large breed bitch, a Great Dane, that had a large litter, and in that bitch we also added Alazine to her treatment protocol. But again, Alazine is is not a product that's available in the U.S., but we've had very good success with the cloprostenol product. It's a horse product, again, an extra label or off-label use, but it's worked very successfully for us to eliminate a pregnancy, and then you don't have to spay your bitch. You've got an alternative to treatment. You don't ever want to use estrogen at the time of mating. The old DES or ECP that we used to use, the estrogens are risky to bitches. The very first dog that I ever saw that used on was a Samoyed. When I was a senior in vet school, I saw her die. So we know that it's pretty serious to use that. So we instead want to use some of the newer treatment protocols. You cannot treat earlier than day 24. It just simply doesn't work. So you have to wait until they're far enough in their pregnancy to ultrasound. If they're ultrasounded and found to be pregnant, we do 2 injections at 4 to 5 day intervals. There will be some bloody vaginal discharge and sometimes some tissues are visible, but it's very successful. There's also new treatment for SIPS. SIPS is subinvolution of placental sites. That's when you see about 4 to 6 weeks after a bitch whelps, you'll see a bright red, bloody vaginal, kind of a mucousy discharge, just a bloop of it on the floor. It's not continuous, but it'll happen periodically when the puppies are old enough that you just think that that shouldn't be happening anymore. It's not a pyometra. It's not metritis. The bitches aren't sick, but it says bright red, bloody vaginal discharge. And there's a new treatment that was published in October of 2013 that uses this, again, this drug Ovaban, at starting off with a higher dose, dropping to a lower dose for a treatment of 14 days. And it's been shown effective in that group of dogs. 7 of 7 dogs successfully were treated for SIPS. So it's an alternative. Don't let your veterinarian talk you into spaying her. It is not pyometra. It is not metritis. It is not serious, but it should be treated to prevent too much blood loss in the bitch. Okay, rendering male and female dogs incapable of reproduction. We, again, like I said, used to have a GnRH vaccine. It was pretty successful in both males and females, but that's currently unavailable. So there are other options that are injectable that are under development. But as an alternative, some of the things that we've been using at our practice have been either vasectomies in the dogs or ovary-sparing spays in the bitches. I believe, like I said, Dr. Waters was talking about lifetime ovary exposure and longevity, so I think it's interesting. There's a lot of clients that are coming along wanting these kinds of procedures. Dr. Benjamin Hart published an article recently in a veterinary publication that talked about longevity and the differences in Labradors, German Shepherds, and Golden Retrievers in longevity. There's a Wiesla study out there. So there's some strong evidence coming on that dogs that are not spayed or neutered have greater longevity, and we also see some other advantages as well. We know that the male dogs will improve or keep their good muscle tone, have a lower risk of obesity if they're not neutered. We know that he'll retain his normal coat, and for some breeds that's pretty important. We know that the dogs will have a lower risk of cancer in many cases, especially Golden Retrievers, a 4 to 5-fold difference in Golden Retrievers. Have less cancer, less lymphoma, less hemangiosarcoma if they're not neutered. The exception to that would be testicular cancer, and if they develop testicular cancer, it's pretty easy to diagnose. You can find it, you can feel it, you can remove the testicles. They rarely spread to other organs. There's a lower risk of thyroid disease and a lower risk of joint disease, especially in Golden Retrievers that are not neutered. The disadvantages are you're going to have ongoing male behavior. That would include marking territory or roaming. You're still going to have a dog that may want to breed bitches. They don't have a decreased risk of prostate disease, but they don't have an increased risk either. And they aren't protected against perineal masses or perineal masses and perineal hernias. But we have an increasing number of clients that are interested in vasectomies as a way to control their dog's reproductive capacity. They can still mate, but no one really expects them to. But the main thing is that they're not able to reproduce. So it's a nice way to be able to manage the male's fertility without losing their coat, losing their muscle tone, and losing that protective effect of testosterone. In the bitches, there are some people that are leaving the uterus and taking out the ovaries, but you don't get the protection against some of the things that we'll talk about. Tubal ligation is currently not being advised because there's still some risks that go with that. But the ovary-sparing spay is another really interesting thing. So we're leaving ovaries on purpose. There's actually a Facebook page for this. So if anybody's interested, you can find ovary-sparing spay Facebook page. I had no idea that there were enough people interested in it, but there are. So that number of people is growing every day. Again, in the bitch, the advantage is she'll retain good muscle tone and has a lower risk of obesity. She'll retain her normal coat. You can tell a spayed bitch coat. a mile away on some of the bitches that we see. Samoyeds, my gosh, they walk into the office and you know they're spayed. You don't even have to ask, right? They have a lower risk of cancer, except for mammary cancer. They have a lower risk of thyroid disease, a lower risk of joint disease, again, particularly in the golden retriever, and a lower risk of urinary incontinence. You do not have a lower risk of mammary cancer. In fact, mammary cancer is probably increased. But again, mammary tumors are easily diagnosed, and if they're removed when they're small, almost all bitches are successfully treated with just removing the lump. She will have ongoing sexual behaviors. They may have some vaginal discharge, but we have clients that are now asking for this ovary-sparing spay procedure or vasectomies. In the old days, they used to be able to sue me for leaving ovaries, but now I get paid extra for leaving them in. It's a pretty good deal. Yeah. So I just want to mention briefly National Animal Interest Alliance, for those of you who may not be familiar with it. It's your ally in your legislative assistance in dogs and keeping dogs in your lives. So keep an eye on what NAIA is doing. It's a pretty important group. I want to briefly mention a few things about what's new this year, and that's the AKC Theriogenology Residency Program. The Therio Foundation is pleased to announce the establishment of the AKC Therio Foundation Companion Animal Residency Theriogenology. It's at 3 schools right now. We're hoping for expansion. We have students at University of California, Davis, at Auburn University, and the University of Pennsylvania. There are 3 residencies which began in 2014, and they are supported by a generous grant from the AKC. I brought along some flyers. They're out on the table if you had a chance to pick them up. From the Society for Theriogenology. These are the purple flyers, and this is a starting point for a strong collaborative effort between the 2 organizations, AKC and Theriogenology. We have with us today our 3 residents. We have Dr. Natalie Fraser from Auburn. You want to stand up, please? Dr. Andrea Hesser from UC Davis. And Dr. Carol Margolis from UPenn. These 3 aspiring theriogenologists are our future in veterinary medicine. These are the people that we need to look to. There's a rapidly changing world in a lot of places, and we're hoping that this combination will help us with healthier litters, puppies with predictable aptitudes and temperaments. It's an important group, and it's important that we support them. So we're hoping that you'll be part of Theriogenology's future and supporting these young students. So please introduce yourselves to them. Please welcome them to this group. It's very exciting to have this opportunity to have Therio and AKC in this collaborative effort to educate our residents. It's an expensive course of study, so we're glad to have the AKC's support. I'll conclude with, we give dogs time we can spare, space we can spare, and love we can spare. In return, they give us their all. It's the best deal man ever made. I can be reached at, that's one of those adorable corgis. That's really mine. I can be reached here. So if anybody has anything that they need, you can certainly send me an email, give me a call, check us out on Facebook, whatever you need to do to find us. But thank you for letting me speak today.